another day to be joined by our friends at the Freeport Clinic because we are getting into the insight as Dr. Rohit Dass joins us once more in his capacity of Medical Director and CEO at the Freeport Medical Center. Good morning and welcome back.
Thank you very much. Good morning to you and all our viewers on TTT this morning.
Nice to have you.
I am extremely excited to be here to share some of my knowledge and experience on this very important topic of diabetes.
But before we get to that,
Yes.
we know that you had a couple of events to actually make sure that persons not only heard about it, but kind of experienced it with the health fair and 5K on
Yes.
Sunday. So tell me a little bit of an update. How did things go on Sunday?
Yes. Well, I probably had to beat my own drum this morning. I have to say it was an extreme success. It was
Nice.
extremely successful. When we started off planning this, we said if we get 400 persons attending, we would be happy.
Right.
And on Sunday morning, lo and behold, there was over 1,000 persons.
Nice.
So the 5K was very successful. We had a lot of persons also donating stuff who came on board. And I want to say a special thanks to the Elderly Athletic Association. We had a lot of elderly person who actually finished the 5K and attended the health fair, and even persons from the blind welfare. So I just want to take this opportunity to thank everyone who attended, as well as persons who donated and assisted on that day, and our gold sponsor, which was Guardian Life Insurance. So I'd just like to thank them here. Although we did it on social media yesterday, I still want to do it publicly
Of course,
yes.
because it would have definitely altogether come together to make sure that Freeport and environs enjoyed a successful 5K and health fair. So congratulations.
Yes,
then.
thanks very much. Yes.
But of course, the focus is heavily on diabetes. And so for those who are just joining the conversation, Doctor, give us a little bit of a breakdown. How common is diabetes locally?
Yeah. Diabetes to me, is a very, very common condition. It has a very high prevalence in Trinidad and Tobago. And just to put things in perspective, you remember it's a metabolic disease, a chronic illness, which is characterized by high blood sugars, right? And it comes about because your body is either not producing sufficient insulin, or the insulin that is being produced is not being utilized properly due to probably insulin resistance or obesity, as the case may be. According to the World Health Organization, there are 850 million persons living with diabetes, and diabetes takes about 3 million deaths per year. In Trinidad, it is extremely important to know that diabetes is one of the main causes of strokes, heart attacks, blindness, kidney failure, erectile dysfunction, and lower limb amputations. So it's a really serious condition, and we need to understand a lot about it.
Well, in terms of understanding it, we are familiar with the terms, and I mean, people talk about your sugar levels all the time, but there is type 1 diabetes and type 2. Give me some distinctions between the two things.
Yes, good. So there's an important concept to understand that when we say your body, well, your pancreatic gland produces insulin, right? And this insulin is what is used to reduce your blood sugar. If your blood sugar is over a certain amount, depending on your age group, generally above 120 to 140, it is dangerous to your body because it affects your internal organs. So in terms of type 1, this is the one where it is considered to be an autoimmune disease where your own immune system destroys the insulin cells, which are called the beta cells in the pancreas. And therefore, you're not producing any more insulin, and now you become insulin dependent. That is one of the main distinctions. So a person who is type 1 is generally a younger person because it's inherited by a gene on the HLA, the pathophysiology and stuff. But it's inherited by a gene, and that gene now will cause you to digest and damage your own beta cells. So it's usually a young person, a child or a young person, and they become insulin dependent. If they don't take insulin, then they go into a coma. As opposed to type 2, which is generally seen in the middle-aged and elderly persons. It also has a genetic predisposition, but is mostly related to your choices and your lifestyle.
Okay.
So if a person is having too much sweets and, the lifestyle is not too much athletic or obesity and so on, it will bring it on faster. It also has a genetic predisposition, but it can be delayed to a later stage.
Okay.
So in that case, patient can use tablets to control it because you already have insulin, but later down it may become insulin as well. You may need to use insulin.
Okay.
So that's the major difference. So the age group, again, is genetic for type 1, and type 2 is, you can use tablets as the case may be to reduce the blood sugars.
So it sounds like in terms of type 1, you would determine that earlier in that person, because you mentioned for one, they're younger persons usually, whereas the other you may see later on in life.
Correct.
How do we look, or how do we make those distinctions? What are some of the signs that we could look for in terms of seeing that diabetic tendency?
Yeah, in general parlance in medicine, we say polyuria, polydipsia, and polyphagia. I don't know if you ever heard of that, but in general medical parlance. But what it means is that what I will ask my patients when they come in, are you drinking more water than you would accustomed drinking? Let me say you drink 5 or 6 glasses of water for the day.
Right.
Is it that recent times you find you're feeling more thirsty, you want to drink more water? How many times do you get up in the night to pass urine? If you don't get up at all, which is normal in young persons, and you start getting up to pass urine, that's our next important sign. If you find that you want to eat a little more, but you're not seeing the weight coming on your desk, you're eating polyphagia, then you have to check, okay?
I feel like I have to check.
Persons complain about blurry vision when the sugar is high.
Okay.
Sometimes, if it gets really bad and it's undetected, you may get a little chest pain sometimes. Okay. And, of course, in men, the erectile problem, they tell you, oh, gosh, you're not getting a proper erection. And then a common complaint is burning in your feet. You feel like a burning or a heaviness. And those are the key symptoms you have to look out for. Together with if you have a family history of diabetes or if you're overweight, you need to check soon as possible.
All right, so that's the initials where you yourself can determine this is irregular for me, and then you come to the doctor.
Yes.
Tell me about the tests then that we're going to be exposed to.
Yeah, definitely. There are 2 main tests that we do and we recommend all the time. I tell my patients, if you have a family history of diabetes from the age of 35, you should start doing tests. Okay. And if not, as a general test from the age of 40. There's a test called a glucose tolerance test, which if you come in the morning, you check your blood sugar. If your fasting blood sugar is more than 110, and 2 hours after, if it's over 200, you're diabetic. There's no question about that. Yes. And there's a test called the HbA1c. It's probably, a lot of persons probably know about it. If your HbA1c, it do not need to be fasting, you can do it at any time. Okay. If it crosses 6.5, you're diabetic. If you're below 5.6, you're safe, and then between that value, you're called pre-diabetic.
Okay.
All right. As a doctor, we can use our discretion as well. There's another way. If a patient has the symptoms and their sugar is always over 200, well, then we can also diagnose them. But that one is by the doctor. The first 2 is really the more scientific way.
Now, what you're describing, are these intensive or painstaking, in any way physically demanding tests that we will be subjected to?
No, not really, because what we have seen is that because of the high prevalence and our change in lifestyle, persons who would have become diabetic in their 50s and later on are now becoming diabetic at an earlier age. So therefore, you go to a doctor. Again, if you have the risk factors of being overweight, not exercising, and eating badly and stuff like that, you go by a doctor at least every 6 months, a minimum of a year, and get these tests done. And it's not like you have to do special preparations and things like that, because a HbA1c is not a fasting blood test.
Right. You said you could do that at any time.
Yes.
So I'm asking just in the sense of somebody now starting the process of doing their health checks or even just checking up on their family history and understanding themselves, might be a little intimidated to go to the doctor. And sometimes, depending on how the tests are done, don't like the sight of blood or needles. It's a simple test, simple processes, yes?
Correct. Yes. And the thing is, you know, like nowadays you have the glucometers, which you can do the finger stick. It gives you a little guide. It's not like a 100% accurate, but it gives you a guide, and it can be done at the pharmacy. That's a finger prick, and you can have an idea where your blood sugar is.
Right.
Remember, we also have to rule out the other risk factors like high cholesterol, high blood pressure, and all of these things to ensure that you don't end up in problems.
And I know you've made a distinction before, but as you mentioned it, blood pressure versus blood sugar. Make the distinction for us as well, please.
Yes. Well, your normal blood pressure is 120/80.
Right.
That is where the heart pumps the blood to ensure proper circulation throughout your body. That's the blood pressure. If your blood pressure is over 140/90, that's called hypertension. But we actually say that it should be elevated at least twice before you diagnose a person. As opposed to blood sugar, fasting blood sugar should not cross 110 to 120.
Got it. Making sure you know your numbers is important. But once you're diagnosed, what is good management that we should then look forward to?
I'm really excited about this thing. Let me tell you, when patients come to me, I tell them one time, if you are diabetic, you have and you must change your diet. End of story. Patients sometimes feel that you can eat whatever you want to eat and take the tablets and feel you can control the sugar. That don't work at all. You're going to end up in problems. Your diet is the first and the most important thing, right? You have to cut off refined sugars, processed foods. You have to make sure the rice and flour, you have to control these things that we are accustomed eating in Trinidad, particularly for dinner time where the sugar spikes at nights and cause problems. Okay. So your diet is the first and most important. Secondly, I advise my patients that, okay, you know that you're diabetic now. The second thing that you have to do for yourself is you have to start exercising.
Of course.
Get your blood circulating, increase your metabolism, and help to break down some of these sugars yourself. And thirdly, based on what the patient levels are, we put them on different tablets to help with that, right? And of course, we actually ask them to monitor their risk factors, where they have to do regular blood tests, they have to check the sugars morning and evening, check for complications, check your kidney function, your liver function, your cholesterol. Even some patients may even have to do angiograms to check their heart for blockage and things like that. Yes.
A lot of those things, though, I imagine you will offer support for at the clinic. So tell me, what other services do you offer there? Yes. Not just in terms of diabetes.
Yes. At Freeport, we proud of ourselves of being a complete private medical facility providing all these diagnostic services. And we really, as a head doctor, I advocate for preventative care medicine. Preventative care meaning that we try to pick up the patient before they have problems, and we have a full diagnostic lab including X-ray, ultrasound. We are proud of our big unit of dialysis, and we also have been a pioneer in Central with our new state-of-the-art CT scanning, doing angiograms at Freeport. So we are really excited about all of these things.
Things to get excited about, because as you rightfully say, prevention better than cure. So why not come through, get the test done, make sure that you know your numbers, and that way you don't have to wait till it reaches the point of needing to be managed altogether. Definitely. Sounds like a plan, but it's also reassuring to know that all of these things are available at the clinic. So we really appreciate you passing through this morning to make sure that we get the insight. On the screens right now, we are showing some of the packages and the available options in terms of those diagnostics that you mentioned. But of course, if persons wanted to get more information, how can we connect with you, Doctor?
Yes, we are available on social media, Facebook, Instagram. Our phone number is 673-1069 and 681-8174. Available at all times. We have a 24-hour hotline as well, where persons at the 681 number, where 8174, where we answer at all times.
That's fantastic.
We are always there for our patients. We believe in, being there and supporting our patients at all times.
Well, we have been happy to support you, having you come on to give us this information on something that is very prevalent in Trinidad and Tobago, but giving us the insight not just to spot it early or to manage it, but even to prevent it. We truly appreciate you, Dr. Rohit. You really gave us some insightful stuff that, honestly, I'm going to check on now because I really like sweets. I do exercise too much. I'm a little worried, but I'm not necessarily predisposed family-wise. So thank you for letting us know that we can get the support we need at the medical services in Freeport, well, Freeport Medical Center. Now, in terms of wrapping things up, any final messages that you'd like to share with us this morning?
I like to say that if you are 40, from our experience, all persons should be screened for diabetes. It's a very common problem. Is 1 in 8 adults in Trinidad suffers from diabetes. 1 in 8. Our population being 1.5 million, imagine we already have 150 persons with diabetes. 150,000 persons with diabetes, right? And that is the only diagnosed one. What about the ones who are not diagnosed and walking around? So if you have a family history though, like a mother, father, brothers or sisters, you should start testing from 35. Right? Come into us, we do all the tests, and we'll take you from there, walk you through the whole process of screening for complications and everything else at Freeport Medical Center.
And in that case, we thank you, Dr. Das, for joining us today and all the other days that you have to make sure we are aware of how to manage our health through the Freeport Medical Center. Thank you so much for joining us. Have a good day.
Thank you very much. I appreciate it.
And guys, be sure to make sure that you take care of yourself, not just in terms of diabetes, but generally, because we want you to come back and enjoy more with us here on the Now Morning Show after these messages.
Another day above ground, I see. I focusing on the positives, because yesterday I was down. People do me wrong, but it's loving me hard.